Today we are covering substance use disorders, focusing on how the NCLEX will test your ability to prioritize care during intoxication and withdrawal. The exam will give you a scenario with multiple patients and ask which one you must see first. The answer will almost always be the patient experiencing alcohol withdrawal. This is because alcohol withdrawal can progress to delirium tremens, a medical emergency with a high mortality rate due to cardiovascular collapse and seizures. Be prepared for questions that require you to recognize the early signs like tremors, anxiety, and diaphoresis, and to know that benzodiazepines like chlordiazepoxide or lorazepam are the first-line treatment to prevent progression to seizures. The exam will test your knowledge of assessment tools, specifically the CIWA-Ar scale, to quantify withdrawal severity and titrate medication. A common trap is to confuse the symptoms of alcohol withdrawal with opioid withdrawal. While opioid withdrawal is intensely uncomfortable, it is not typically life-threatening. The NCLEX expects you to know this distinction for prioritization questions. For a patient experiencing opioid withdrawal, you'll see symptoms like yawning, lacrimation, rhinorrhea, and muscle aches, which are assessed using the COWS scale. The key nursing priority here is symptom management, not seizure prevention. Now let's discuss pharmacology, a major source of trick questions. The exam will try to confuse you about naloxone. Remember, naloxone is an antagonist used to reverse the respiratory depression of an acute opioid overdose, not to manage withdrawal symptoms. For long-term management of opioid use disorder, the exam will test your knowledge of medication-assisted treatments like methadone and buprenorphine. Another critical safety area is stimulant withdrawal, particularly from cocaine or amphetamines. While there aren't the same dramatic physical symptoms as alcohol or opioid withdrawal, the primary risk is severe depression and intense suicidal ideation. Therefore, any question about a patient crashing from stimulants requires you to prioritize suicide precautions and safety. Lastly, don't forget about benzodiazepine withdrawal. It mirrors alcohol withdrawal and is also a life-threatening emergency that can cause seizures, so a gradual taper under medical supervision is essential. To keep the key differences straight, use this mental shortcut: opiate opposite. Opiate intoxication causes classic signs of central nervous system depression, such as pinpoint pupils, lethargy, and respiratory depression. Opiate withdrawal is the exact opposite, a state of hyperexcitement with dilated pupils, agitation, tachycardia, and hypertension. Knowing this simple contrast will help you instantly differentiate between the two states in an exam question and select the correct nursing interventions.